Hi, everyone. Good afternoon and happy New Year's Eve to all of you. Thank you for taking time out of your time to join us today. Once again, I'm coming to you live here from home in Gardner. And thanks to our whole team for making it work to do this virtually. Despite my best efforts to take a little bit of time off this week, I've been closely monitoring what's going on with COVID and many other challenges in the county. The good news is our team has been on it, and our community has largely been on it and doing all the right things. So we are being as proactive and leaning forward as much as we can as we wrap up this 2020, which has been a year none of us could have possibly imagined or completely been ready for, but one in which I really think we also saw a whole host of really positive silver lining moments of us coming together as a community and taking care of each other and really extending a hand to those in need. So we'll talk more about that in a moment, but I'm appreciative on this last day of this year to have a few minutes to be with all of you and to talk about what's going on, not only with COVID, but just more broadly as we head into the new year and hopefully turn the page towards a 2021 that will be healthier and brighter. So without any further ado, we'll dive into the COVID update. We are continuing to see significant spread of COVID-19 in Ulster County as part of the second wave, and remain very much concerned about the impacts that the holiday period could have and possibly even already is having in terms of the spread of the COVID-19 virus across the county. Tonight and tomorrow with New Year's Eve and New Year's Day, another occasion that we always or often mark by getting together. It's really another opportunity for us to, rather than letting the virus get its way, for us to have our way and to finally flatten this second curve of the second wave and try to get through this winter into the spring. Since the last update, we have seen cases continue to increase in the county. We're now at another record high of active cases, over 2,300. And unfortunately, since our last update 2 days ago, I have to report another 2 fatalities. So once again, at the end of the month of December, to have had 37 fatalities, more than one a day, from this pandemic in Ulster County is not the way that any of us wanted to end this year. And we have to turn this around and get this back under control as we head into the spring. We are also seeing, and we'll talk about the numbers in a minute, hospitalizations increase up towards to 29 now from 23 48 hours ago. In terms of the total cumulative cases, we're now well over 6,000, 6,110. And our total test numbers, you can see, are quickly approaching 200,000. We are continuing to push on the testing front and to get our testing numbers up, which we need to continue to do and will continue to do. We've seen 3651 recover. And as I mentioned, unfortunately now 138 cumulative fatalities, and especially during the holiday season, I want to send personally from Rebecca and I and our family and from the whole county team our condolences and our love to all those affected, not just with losing someone, but with their loved one hospitalized or seriously sick from COVID and anything else that's challenging your family right now. We're sending as much positive energy as we possibly can from the Ryan household to you all during this really tough time. As we look at hospitalization numbers, as I mentioned, we are seeing these continue to tick up. We had a slight decrease towards in the last week or so, but now we are back up to 29 in Ulster County hospitalized right now. We were at 23 2 days ago. And you can see the trend line projected is for it to continue to increase. And that, just so you understand, that dashed trend line is a forecast really tied to the number of active cases that we're seeing. So remembering to a certain degree, we can anticipate if so many people have COVID, a certain percentage of those will be hospitalized. And so the more cases we have of total COVID, the higher the likelihood that we will test our hospital system. And that's where that projection number comes from. Looking at active cases, you can see very clearly here, this gives you a sense of what our 2020 has really looked like. The graph starts in March, late February, but you can see the sheer magnitude of the second wave that we're in now on the far right of the graph compared to the magnitude of the first wave, and remembering how severe that was. It shows that we have improved in our ability to deal with the effects of COVID, at least on the health front, but we are very, very concerned to see that active case number continue to climb, now over 2,300, to see that continue to climb, knowing that the likelihood that that will continue to go up given holiday gatherings is very high, and essentially a certainty, unfortunately, at this point, based on what we've seen from previous holiday periods of folks getting together. So please factor that into mind as you're making your plans, or maybe not making plans, hopefully, to see other people. I know for Rebecca and I tonight, she's stuck with me. We'll be on the couch, and we may or may not make it until the ball drops. We'll see. But it's okay to have a boring New Year's Eve this year, knowing that we have a light at the end of the tunnel on the other side of this. Moving on to our next data point and graph. This is where we look at the number of new positive cases each day. Once again, the trend here is very clear, and it's clear we're still at a point of great risk and of community spread at this point. I can't emphasize that enough. As a reminder, community spread means that the virus has reached a point where it's highly likely that it's widely spread across the county, that there are many people who may be asymptomatic or pre-symptomatic with COVID and may not know it yet, or have been able to get a test yet, or get the results yet. And that means that the likelihood of transmission is much, much higher. To give you some of the numbers here of over the last 2-day, 48-hour period, we remain at a high testing level. We've tested 2,614 in just the last 48 hours, 2,614. And we have had 282 positive cases out of that 2,614 tested. That puts us at a very high rate of 10.8% for a 48-hour average. That's without question one of the highest rates we've had over a multi-day average period. And remember, I keep coming back to what Dr. Fauci said in congressional testimony a few weeks ago. The concern here is a surge on top of a surge, or a wave on top of another wave, when things could really get much more widespread and begin to test our hospital capacity, and of course continue to up the toll on suffering and sickness, and potentially even loss of life. In the last 24-hour period, we've been at an 8.25% rate. So the numbers over the last 2 days are really another wake-up call. Yesterday, we had 154 new cases, and today 128. Yesterday's one-day total of 154 was one of the highest we've had, if not the highest, throughout the entire period, and today's is very close. So I never like to be the bearer of bad news, but I think it's important that we recognize where we're at the end of this year and going into another tough beginning anyway of 2021 in the winter and early spring, that this is the worst that the pandemic has been. I know it feels a little bit different out there, and I understand that we've been through a lot of challenges, and we've asked a lot of folks, and that this has not been easy. But from a pure sort of public health and science perspective, we are without question at the worst point of the entire pandemic, and we have to adjust our behavior accordingly. And we're doing as much as we can on that front as a government and at every level. And we also need the help and the buy-in and the support of everyone in the community. Continuing to go through our slides and numbers here, looking at our projections going forward, you can see continued, unless something changes in the growth rate, which would require us to continue to change behavior. This is where we see the numbers continuing to climb. The climb now, the second period is significantly longer and steeper, you'll notice, than the first period back in the spring. Looking at hospital capacity, this is one good news story here relatively from a capacity perspective. While we do have very high number hospitalized at 29 with 4 in the ICU, we have gotten much better at maintaining and ensuring we have sufficient hospital capacity. So that is good in that we are prepared to deal with those who are hospitalized. But of course, the fact that we have so many hospitalized is really, really tough to stomach at a point when, again, I think about a holiday period where many of us are thinking about, are worried or upset or frustrated that we can't see our loved ones. But I think about those 29 individuals in the hospital who are fighting for their lives, who definitely can't see their loved ones, and their loved ones can't see them, and they have this horrible dread and anxiety due to that sickness. We have to get these numbers down, and that requires all of us playing our part. Moving on to our next slide, we transition to the point at which we say, okay, it is bad. The numbers are not good. What can each of us do to affect this? And for those that watch regularly, the message has not changed because the science has not changed and the public health advice has not changed significantly. These are the big three that we know worked in the past in terms of mask wearing, social distancing, and hand washing. The big update, which is not that new at this point, is the prevalence of social gatherings, and whether they be just a few people or bigger ones, as the main sort of transmission method for COVID. And so we know it's cold outside and people are more likely to be indoors. We know the holidays, of course, want to bring people together, but we're going to have to fight our normal sort of behaviors and instincts. And if you do absolutely need to see people, to do so outdoors or at a significant distance. The amount of time that one spends indoors with others also does matter. So factoring all of those in and adjusting your behavior and encouraging others to do the same is a key part of how we're going to slow this spread. And I know that this has been tough for people because we've gotten many questions and calls and comments saying, why haven't you done widespread shutdowns like we did before? Why aren't we closing certain things? And the reality of it is that we saw this in the summer when we reopened. We can do many things safely, from letting small businesses operate to, in many cases, operating schools, all in a very different way with a whole bunch of procedures and protocols and safety precautions. We can do those things if people choose to do so. So much of this, which is frustrating for all of us, is a sort of an effort to convince people to change their behavior. We don't believe that those, at this point, widespread closures, it's mostly a state decision, but I agree with this, that we don't believe that those widespread closures would dramatically change things. We really think that changing this comes down to convincing individuals that they're going to need to change their behavior, that they're going to have to make some small sacrifices individually and as a family in order to think about the rest of us. So once again, at a moment where I hope all of us are thinking about not just ourselves and our family, but where the whole community is at, we need to encourage and urge and nudge and remind our neighbors and others who may not get this, that this is about thinking about others at a time like this and remembering how interconnected we all are. So please be a spreader of that good word and those guidelines rather than, of course, COVID, to make a bad pun. Moving on to the next slide, I do want to talk a little bit more about what else we are doing to try to remain proactive, even in the face of continued spread. We, as I said earlier, are still pushing on every front to expand testing. I am hopeful that with a change at the federal level coming, and some of the initial plans we're hearing from the incoming Biden administration in terms of ramping up the Defense Production Act, finally rolling out an actual comprehensive federal plan to expand testing resources and funding, that we will start to see that expand. Right now, given the constraints at the federal level, we are pushing as much as we can to expand hours, to add more sites. And so we are making headway there slowly in the county, but I know that that's something we need to continue to push on, and we will. We continue to add to our public health staff to be ready, not just to deal with the COVID sort of virus as it exists now, and dealing with those that are sick and checking in on them and monitoring them, but also preparing for the third part here, which is the most significant effort we've undertaken to date in the pandemic, to get the vaccine safely, quickly, and equitably distributed to hundreds of thousands of people here in the county. And planning continues for that. I'll talk about that in a moment. But I think we are on a good path now, and are really thinking and working through the details on that, and in a good place heading into the new year to be able to do that well, and to do right by all the residents of the county. So on that front, as a reminder, here are the phases of what the vaccination process will look like. There are 5 phases that New York State has outlined. I know the print is a little bit small here, but essentially phase 1, which is where we still are, is still focused on our critical healthcare workers, our long-term senior care facilities, and other long-term care facilities. Starting very shortly, we will be also starting to administer vaccines to other group homes, including those for people with developmental disabilities throughout the county, to ensure that those locations are also addressed early on. Those have been, along with our senior facilities, 2 of our greatest points of risk for COVID spread and for people getting sick. So I think it's absolutely right that that's where our initial focus is. And then we also we are currently undergoing vaccinations for our EMTs and other critical medical experts and health experts, public health experts that are out there. We'll also start to get our public health nurses who will be administering the vaccine, to get them vaccinated for their protection as well. So that's the work that's happening now. As we come into January, probably in mid-January, we'll then expand into that phase 2 as we start to get to more folks on that list that have been our frontline and our essential workers, really heroic throughout this year in putting themselves at risk. We want to make sure that they are next in line to be vaccinated as well. And so that planning is happening. And then, as you can see, we'll move through 3, 4, and 5 based on other risk factors, age, and other existing conditions that put people at greater risk. We think that this, and just to set expectations, will be a multi-month process, that even when some in the community have been vaccinated, we'll still be asking everyone else to continue to and them to continue to follow mask guidelines and other guidelines until we can get to a point of herd immunity due to the vaccine. So unfortunately, we're still going to have many more months here, but fortunately, we have a plan in place. We're going to continue to refine and build on that plan, and we at least have this to look forward to and to work towards and to rally around. Final update on vaccines. Actually, this evening or late this afternoon, we'll be convening again our Vaccine Distribution Coalition, which is a broad group from across the county of health experts, community leaders, faith and religious leaders, and others, to make sure that we're thinking through a really a safe and equitable way to make sure that everyone is vaccinated fairly, that we can get the word out, and that we can build trust in the vaccination itself and our processes to do it. So we'll be meeting tonight with that group, and I thank everyone that's participated there. We will also be broadening that coalition as we go. I think the key message on vaccines, we've started to get more and more inquiries and questions about how do I sign up, when will I be getting it. As soon as we have dates and details, we will, and I will absolutely be sharing them with you all. At this point, we're still, as I said, in the midst of planning what is a very complex process across the entire state and, of course, the entire country. And we've made major headway in the last week or two. I think that probably early-ish, mid next week, I'll be able to share much more detail about our vaccine distribution plan and how we're seeing that play out. In terms of timing, it really is going to be, we'll have general windows and ideas of the sequencing, but it's really going to be driven by the availability of the vaccine based on how quickly they can produce it and get it out to us. But please rest assured, as soon as we know things and have details finalized that we can share, we will do that. That will include the timeline, the locations, the plan to communicate, the plan to sign up, and all of those pieces. So I thank everybody as part of that coalition that's doing that work with us. So I believe that is our last slide. I don't have the slides printed out in front of me. Ah, yes, a programming note. Thank you. A programming note as part of just to mix things up a little bit, but also to make sure that we can have all the latest information for you all. We're actually going to slightly adjust the time starting next week. So starting in the new year, we'll be keeping these scheduled updates the same days, Tuesdays and Thursdays, but we're pushing them back 1 hour to 3 p.m. Eastern. And just so you know, the reasoning on that, the main reason is that we get these numbers that I report often late morning or even early afternoon, and pushing back an hour will let us actually share more up-to-date and more accurate information with you when we do the updates. So I apologize to anyone who's got that for whom that'll cause a scheduling change, but we wanted to do it to make sure we can have the latest and best information when we do get together. So we'll remind everybody of this as well on our Facebook page and social media and so on. But please, if you're a regular watcher, please adjust your plans around that. And thanks for your understanding with moving that time. So that brings us to New Year's Eve, and it is I think it's one of those moments for all of us where we feel definitely not the normal feeling of New Year's Eve and heading into a new year. But I really do think that despite the challenges of this year, and knowing that literally as we speak right now, there are many that are sick and some that are really, really sick. I say this with that in mind, but I'm actually really proud of our community this year. I think we've been tested and challenged in ways that we haven't been in a generation or more, or maybe a few generations. But when I reflect on so many moments that come to mind for me, and I'm somewhat, I think, fortunate in having the window to see small selfless acts that people have undertaken this year, some major things that people have taken on and undertaken, whether that be someone signing up to do a few volunteer shifts to deliver meals to homebound seniors, or whether that be some of our generous philanthropic donors contributing tens or even hundreds of thousands of dollars to make sure that we can run Project Resilience and get food to folks and more meals to seniors and support to our kids and support to families without income, so that people don't have to be out on the streets, so that people don't have to be hungry, so that our kids feel some semblance of normalcy, so that we can run our warming center through these cold winter months, and so many other things that we do. the moments of realizing the interconnectedness of all of us, and really the fragility of this whole thing that we have here as community, to see us respond to that challenge 99% of the time, to see us respond with grace and compassion and ingenuity and generosity. I think that when we can get through this and look back on 2020, I will remember at least those moments. And I urge everybody to keep that perspective as we turn the calendar to a new year here. And as I said earlier, in terms of New Year's Eve and New Year's Day plans, please do stay safe and adjust your plans. We're so close to being able to vaccinate everyone. The last thing that we want to do is have people getting sick or even losing more of our residents, knowing that they were a few days or weeks or months away from a life-saving vaccine. So please keep that in mind. And my closing thought for today, and my thank you for today, is to a group that we haven't talked a lot about. It's not necessarily a group specific to Ulster County, but it's the group of researchers and scientists and health professionals who in this last year have done something almost miraculous in less than a year, designing a vaccine that is going to save hundreds of thousands or maybe even millions of lives, going from a previous record of 4 years, the best ever to design a vaccine, to less than 1 year. And that's the kind of moment and achievement that I think speaks to how remarkable of a country and a society we really are, that once again, faced with a truly unprecedented challenge that would have been easy to sort of throw our hands up, we dug in and did the work, and some great scientists and researchers who need to be held up as heroes did something, and I think going to the moon, and these truly bold and really remarkable achievements that again will save lives. So I remain hopeful, and I remain optimistic and positive, even in the face of all the challenge, and in some ways even more so because of how we've risen to the challenge. So thanks to each of you for your part that you've played in that, because each one of us has played a part in that and lifting each other up. And thank you especially to our frontline workers and heroes on this list and otherwise who have played an even greater role. I'm looking forward to 2021, when we'll be able to all physically get together and appreciate each other and honor each other, and start building for sort of the future as we dig ourselves out of this. So I know that was a long soliloquy there, but thank you for indulging. Thank you for tuning in. I want to thank also finally the Radio Kingston team, and including Diane and Manuel, who've sort of become extended family, our whole Ulster County team, for your work through a remarkable year. And I want to especially thank my wife, Rebecca, my son, Theo, who really doesn't even totally know what this year has been through, but we'll tell him someday. And also, my parents and my extended family for your support this tough year. So thanks, everybody. We will see you in the new year. Our next update will be Tuesday at 3 p.m. And until then, be safe and healthy. Here is to a healthier and a brighter 2021. Thank you.